Hello and welcome all. We are glad to have you join us today. It's always nice to connect with all of you. But today, it's even more special as we gather here to celebrate 6 years of InnovatioCuris. So IC turns 6 this month in August. For those of you who have joined for the first time, my name is Parthvee and I'm associated with InnovatioCuris as the head of market access and partnerships. And I'll be your host for the today's program. It's my pleasure to welcome you all once again to this evening and would like to thank you for joining us today on this special meeting on transformation for Indian healthcare system post COVID, a concern that is becoming more and more critical every day. For the flow of the program, we will first have all the talks from the experts, followed by a discussion and a conclusion round. For some housekeeping rules, I would request all the panelists to keep their mics on mute when not in use, and also request all the participants here to type their questions into the Q&A box only. And if the experts are available online, I request them to answer their questions in the Q&A tab. Also, if you see, you have a live transcript option at the bottom of your Zoom console. In case you wish to see the live transcripts for the videos, please click on the tab and you'll be able to see the live transcript. So now, without further ado, I would like to invite the only one person because of whom we all connect today. Although he needs no introduction, he has had multiple hats during his professional journey in the past, and now he is the MD, Managing Director of InnovatioCuris, Surgeon Rear Admiral Retired Dr. V.K. Singh, sir. I request sir to kindly say a few words and set the tone for the program today. Thank you.
Thank you very much, Parthvee, and I congratulate all the team to put up this new format that they have been trying with the Europeans, and for the club, they are using it first time. And the whole purpose of this particular webinar come club meeting is that I'll get the input from the participants as well as the speakers and others, and 3 to 4 pages would be written that what is the solution for the things which have gone wrong during pandemic, and submit to everyone of 95,000 people who are in our network. I'm grateful to all the speakers and the participants who have joined physically. In addition, speakers have already recorded. Thank you very much, Parthvee, and please carry on. Thank you.
Thank you, sir. Can we please have the comment from Dr. V.K. Singh?
Good evening, ladies and gentlemen. I'm Admiral V.K. Singh, and the whole purpose of this exercise is that we prepare a paper based on your inputs and see that after COVID, how should we transform our healthcare, which had lots of ills, insensitiveness, and the weaknesses. I welcome all the speakers as well as all the listeners, and would expect that all of you will give some input so that we can submit it to everyone in the hierarchy. We have gone through a very rough patch. As you all know, I have collected people from diagnostics, from the hospital scene, and from the public health so that we can hear them more properly. Health for all, we have coined lots of terms in the past. Initially, it was Health for All 2000, which we never be able to achieve it because our bed were less than 1 bed per 1,000 population. Now we have 1 bed per 1,000 population, while WHO recommends 3.5 bed per 1,000 population. The doctor, nurses, all the ratios were really showing that we are deficient of everything. The population of the villages have been 70%, but only 30% of the medical assets were there to look after them, and vice versa. It is after the independence, now it is almost 70 years that we are independent. Subsequent government has not paid much attention. That is no doubt about it. Otherwise, we would have not been caught in such a bad mess. It has been that we need to prepare ourselves so that we get all the eventualities we are able to handle. A lot of things has happened. The other things was development goals which we wanted to have. We created National Rural Health Mission, and a lot of money was pumped, but there were no impact analysis. A lot of corruption to the extent that one of the state ministers was in the jail. Some DG health services were killed. So we need to assess the impact of the population, what all impact it has created. It is not that the medical knowledge or management knowledge is not there, but have we applied these management knowledge? Earlier days, there used to be Indian medical services where every district, one civil surgeon usually used to be from the Indian medical services. It's like on the lines of IAS, which government off and on is now also thinking about it. What kind of a healthcare delivery system we can have? The word over, if you really see, one of the things which we can study is like US is the system which is more insurance-based system. It is called Bismarck model, where we have taken diagnosis-related group and many other things. But every system has its own lacuna. What we can adopt, people have tried. We should take best of everything, make our own hybrid system. If you really go to the National Health Service, is more what state provides. It is called beverage model. It is something that the states take care of. Many countries of European Union have their own such model. Why can't we think of all these models and get a hybrid system where we have our own model? And let's make it that in next 10 years, we will be able to achieve it. We have to pump lots of management training, lots of hierarchical impact analysis, and see that how we can look after our population right from cradle to the grave. That means everyone must be covered. All system, what has been, you might have seen in the pandemic, that many things have happened. The health is a state's subject. It is on concurrent list, but states started blaming the center. They started rushing to the court because they didn't want to project themselves as a bad example or bad system. But are we really able to achieve that people could be saved from the miseries of such other things? What we really require, if you really see, that we will need to have hospital or healthcare services which need to be accredited. It is not what NABH is doing, maybe some basic accreditation. We have to do National Digital Health Mission, which has already been launched. It is not that the present government has not done. It has done something, but it is too little and too late. And secondly, 70 years independent ills cannot be taken away in such a short time. However, even this government has not gave the budget allocation which was required. And now what you see, we are buying this stuff at the exuberant cost. Corruption is rampant, which you might have seen on TV, on the drugs, on the other things. One drug in the press, they said, remember they said, is the 70 lakh worth drug is just lying. People thought they will sell it in a black market. It is possible, and the National Digital Health Mission has a mandate of different kind. but it will take time. That all doctors to be registered, health clinics have to be registered, pharmacies have to be registered, and diagnostic lab. There are quacks, there are people who could sell some of the drugs and fleece the patient. All this is possible. We have also done some IIHMR Bharat, and that is the only issue is that many people are not aware how to get into these things and how the system would work for that. You need to improve quality of life, more attention to be public health, and a primary health care which government should put in attention. Also into the rural area. It is basically, let's also, the government has to think how to look after the below poverty line, people, the free treatment totally, while others, you can think of whatever model you want to. We can have a brainstorming by and see how we can improve all the systems which is there. Spoke and hub model is the one which was thought and emphasized. That means patient from the distance will be treated. It will be brought to the hub, that is the district level, if required. And all these community health center, primary health center, they are either the doctors have not been reaching, or if they are reaching there, it is not being really very effective. Gujarat has been there to do, and Gujarat has done something. And similarly, the best practices from each other we can learn and can do. What really is required is something, can we do the impact analysis? What somebody had done? Can we remove the corruption? Can we put the accountability and see that people who are supposed to do that job, are they doing as they should? And take the things in a more appropriate manner so that we transform our health system or healthcare system. It is not, we are now considered on Atmanirbhar, making of many of these equipment. We are also exporting some of the life-saving drugs and other things to other country. We have created some vaccines. All that has been done, like the testing, diagnostic, RT-PCR kits. We have done all that in such a short as possible. Would be able to do it, and we will make a noise so that all policymakers think about it and do something in a time frame not beyond 10 years, maybe earlier. I hope all of us are there in the same tune. I would be sharing the paper, basic paper, which I'll prepare and put everybody's inputs, whatever has been put, and circulate it to everyone, because we have a community of around 95,000 where our communication goes in different format, magazine, and through the Pulse, newsletter, etc. I would also request all of you, encourage you to write all this in our magazine paper so that people of all walks of life, when they raise the voice, then and they improve and they participate, that they can do all this to make India one of the best health system. Cuba is a small country. It is already in news. To make it a good, why not we in India? And let's go together and make it a universal health coverage, as WHO has said, for every citizen of this country. Thank you very much.
Thank you, sir, for the introduction and setting the tone. I would now like to introduce our first speaker for the day, Dr. Amit Raj. He is a cardiologist by profession with various roles in healthcare environment, from clinician to administration, and now a healthcare entrepreneur. Dr. Amit Raj is currently the managing director at Plexus Cardiac Care, driving innovations to deliver value-based cardiac care delivery. Let's hear Dr. Amit's comments on the pain of a hospital and possible solutions.
Good morning. I'm Dr. Amit Raj, CEO of Plexus Cardiac Care. This company has a mission of starting multiple heart hospitals across Tier 2 and Tier 3 cities of Saurashtra, Gujarat state. Well, coming to the topic of pain of a hospital and possible solutions to it. So COVID has really taught us, a varied lesson on this pandemic. So basic points would be probably, from my end, what we faced at our hospital on the COVID phase and heading towards post-COVID, approach is preparedness for something like a huge pandemic within this healthcare ecosystem. So preparedness more or less starts for us. Probably we felt, there was in a Tier 2 city where we feel resource planning, both in terms of manpower and in terms of material resource management and planning. Second most important point was clinical excellence team to kind of approach something like this COVID, and as well as the complications of post-COVID, post-COVID complications, how the clinical excellence team would have an approach and probably solutions to it. Always keeping in mind the quality of the healthcare delivery needs to be spot on. And support services, most important, which we felt the common areas of the hospital fields, a lot of pain is probably on the diagnostics. There was a supply chain disruption and infrastructure changes to kind of cater to this pandemic. So, and as well as most important is something like infectious disease management in a Tier 2, Tier 3 city. Usually infectious disease departments are usually there in a bigger metro hospitals, but in a Tier 2, Tier 3 cities where this kind of a super specialty department is kind of lacking, and we doctors would definitely want infectious disease department is set within a Tier 2 city, and then how approach and management towards a problem like this should be around. And now we post COVID, we've been seeing a lot of complications of COVID, and there is a bizarre change in cardiovascular, cardiorespiratory, diabetic, mental health, all these clinical conditions patients have been presented with. So, and hospitals are tuning in to kind of have a different approach to these pain points. So how we address these are the broad line pain points which hospitals like us we felt, and most common is among them we felt is how a communication gap is set in from a Tier 2 to a Tier 3, then to a Tier 3 village. And patients are finding it difficult to even get consultation with even an MD internal medicine, critical care specialist, super specialty specialist. So it's becoming a challenge. And manpower, again, in the beginning, I had mentioned that manpower resource planning is important. So we felt that there's lack of manpower, skill development among the manpower, and scarcity of medical and paramedical staff. So we all should focus on how do we improve this manpower resource planning. So probable solutions which we felt, I felt as a healthcare management consultant and as a CEO for my company and as well as a cardiologist, we felt that patients had developed a trust between the hospital and the doctor and the patient per se. And way forward, I feel that we should enhance this trust more with stronger bonding of trust and faith from a patient to a hospital and a doctor. This is most important. Well, understanding the needs of a patient at this hour, because 2 episodes of pandemic had really shaken the mental health of every individual, and probably the patients who've been having these symptoms and problems. So needs of a patient usually is on effective communication, quality healthcare, and financial stability, where a patient can go to a hospital and afford the kind of treatment which a patient wants. So healthcare now should look at this basic needs of how affordable we can make our healthcare, and keeping in and ensuring that there's a quality enhancement at all levels of healthcare delivery. And to promote this kind of patient-centric the trust between the patient and the hospital is, number one, the effective communication and availability of doctors at all levels of the clinical as soon as the patient enters a hospital. So patients at a tier 2 city like Rajkot, Gujarat, and tier 3 cities, where we feel now there's a high time where insurance to be more penetrating the tier 2 and tier 3 cities, with the government scheme of IIHMR being very effective. So we feel even private insurance players should take part in that to kind of cover all gamuts of disease and post-COVID complications. So a healthy approach would be to promote a hospital also should inform and communicate and educate patients to have health insurance at all levels, and they should be kind of promoted at a very early stage of individual, and then probably cover for the entire family, and also promote on quality care. Being a doctor, I feel quality care is something which at this moment is kind of to be looked into tier 2 and tier 3 cities, how we improve the overall patient experience, the overall patient satisfaction, patient centricity, and make it much more transparent and communicable to a patient. Most important approach would be for my company, we have taken the digital approach as one of the most effective way of kind of improving our and reaching our patient database. Reaching out to the last mile is our kind of mission, where we have approached, we have taken digital route and wanted to create a digital ecosystem in early diagnosis and consultation. So as you all know, I mean, for the last 12 months, 12 to 14 months, people have been talking on telemedicine. We should improve the usage of medtech integration. A lot of healthcare devices are to be used so that there's an early detection and easy consultation of a patient in their early phase of their symptoms and signs needs to be looked into. And since a digital ecosystem is has to be taken, overall improving the most important at this hour is improving the rural health of the country using a digital approach is probably one of the decent solutions for us to kind of move ahead. And the next important area where I would also focus on a kind of a disruptive collaboration with multiple stakeholders of the healthcare delivery system, name it vendor management, name it a good clinical team, kind of have a unique kind of collaboration, have insurance players getting into this health ecosystem, have collaboration with government and their policies, so that a disruptive healthcare delivery can be rendered, and effective approach should be focused at. So also every hospital is planning and we are as well planning towards a journey of healthcare excellence, both in terms of clinical training programs for the paramedical, medical, and the support team, and a resource planning uh, uh, for vendor management, and for the clinical team resources, because I mean, if a pandemic again comes in, so we should be geared up with our resources, both in terms of manpower and clinical. Effective education is and training, skill development for our medical and paramedical and support team is to be focused on. And the most important is effective communication with all stakeholders, name it patients, name it this clinical staff, the governing bodies, the vendors. So a kind of a disruptive and effective communication is the need of the hour. So I would focus more on at this moment a digital approach, so that keeping patients, bringing the doctor to a patient's laptop, devices, their smartphones is catching up. So we need to effectively have policies towards that, and ensure that there's an effective, the gap which was there can be easily merged with this effective tools of digital approach. And early diagnosis and consultation using medtech devices is also catching up. Most of the hospitals and small startups are gearing up towards this, so that there's an effective communication, there's a bridge, there's reach out, and there's an early diagnosis, and effective communication and consultation can be made. Most importantly, we feel now, secondly, the insurance part, the financial, every patient in a smaller town has run out of cash of their, of their savings to kind of, look after their health of their loved ones. So the promotion of insurance is something, the need of the hour, and the government has come out with their beautiful policies of IIHMR Bharat, which has to be kind of promoted and effectively managed at a smaller town and at village level. Thank you.
Thank you, Amit sir, for bringing out some real pain points from a hospital's perspective and some possible solutions that could help. Thank you so much. Our next speaker is one of the renowned names of the diagnostics industry, Honorary Brigadier Dr. Arvind Lal sir. He is a pioneer in bringing laboratory services in India at par with the Western world. Under his expert guidance and leadership, Dr. Lal PathLabs has become one of the most reputed laboratories in Asia and one of the most successful IPOs in the history of the National Stock Exchange. Let's hear sir's expert opinion.
Good afternoon, and this is Dr. Arvind Lal here, and I would first like to thank InnovatioCuris for getting me here, and especially my mentor, my friend, philosopher, and guide, Dr. Rear Admiral V.K. Singh, and his team, ably assisted by Mr. Sachin Gaur and all the other people. So this is a topic which is a very burning topic, and thanks for asking me to speak. So the Indian healthcare system, as you all know, and especially in pandemic, we should have done better, as we are supposed to be quite high up in treatment and running tertiary hospitals, and many people from foreign countries, they come actually to India to get themselves treated, what you call medical tourism. And at one point of time, the medical tourism market in India had exceeded more than 10% of the entire workflow of a hospital. So due to COVID, well, it has, for all practical purposes, it became zero. And even people from one town to the other town were having a problem. And the system was absolutely inundated with the COVID patients. So in the first wave, we did slightly better. And there were not enough casualties, I should say. And we were able to exercise lockdowns, and it was very strictly enforced. and many people could, come out of the lockdown, and we did not have many, deaths in India. Having said that, there was, a sense of jubilation. Many people, including in the government, including in private, many people thought that we have won over the COVID pandemic. And we announced, I think, our victory slightly earlier than what we should have. And that gave, rise to complacency. We were not able to ensure the COVID, applicant behavior, which is masking and maintaining, distance, and not going for congregations, whether they are religious or they're political, etc. So that actually, gave rise to the COVID endemic second phase. So if you remember your trigonometry, it is a sine wave. It goes up and down. It goes down below normal, and then it again comes up when people start, literally unmasking, collecting together, going for parties. You have seen what happens when miles of cars were, seen on the road to Mussoorie and Simla, etc. I believe as soon as the unlocking was done, in a few hours only, one mall in Delhi received 19,000 visitors, and there was no place to stand even. So you understand that we could have done without, and we have to follow the same principle which was told to us by so many people, by our seniors, by our very senior doctors. Dr. Guleria used to come on the TV very often. And that was, you have got to do, what you call T3V now. T3 is test, track, and treat. Treatment also means isolation. And V stands for vaccination. So we must not be able to forget these three cardinal principles on which the COVID, pandemic cure or management is built upon. The moment you forget one of these, well, you are in for trouble. So I am glad, being a diagnostician myself, I am so happy to note that when we were called by Professor Balram Bharat, the DG of IIHMR, and he especially called me, and I took along some other people also from my industry, from diagnostics space. And he said, Dr. Lal, you have got to lead the way and start testing for this, wretched virus, that is COVID-19 virus. And you will not believe it, at that time, there was only one, lab doing the testing. Today, I'm happy to say that there are more than 1,500 RT-PCR labs, and out of which 60% belong to the private sector. And this is not, anything unusual. You already know that 70% of the patients in India are treated in the private sector, and about 60% of inpatients also. So private sector, in other words, is the foundation of healthcare in India. And therefore, we were also not found wanting to perform our duties in the sector. So people like us have already tested millions of RT-PCR tests. And what we had never thought in our lives, this is, a patient whom we did not want to come to our labs and to our collection center because he was potentially infective. So we had to go to the patient's home, and we had to learn new things. As they say that, innovation comes at the time of great need. So this was a very big disruptor for us, and we were doing 3,000 to 4,000, RT-PCR home collections a day, and that taught us so many other things. And we tried to, keep our patients and customers happy. But when the pressure is so much, somewhere we may have gone wrong. So we were very quick to apologize and correct it. But fact of the matter is that the pandemic has come after 101 years. So it is not going to leave you and me in peace. And what do? Either we say that we ignore you. You cannot do that. So you've got to accept facts. And as I told you about the sine curve, it will go up and down. And we also have to remember that if there is no life, there is going to be no livelihood. But having said that, there are people who lost their jobs and they were able to, daily wages workers, you've heard about these migrant cases, etc. So these people were really hard hit. So for that, since I am not, in the government, I can't remark much, but these people also have to be looked after. The economic side of the whole thing was that it's a 20 lakh crore money had been sanctioned by the government as a special, kind of provision to get over the COVID pandemic. And I hope all that, has also gone to the rightful places. The courts are still fighting over it. The court says that, well, every person who died should be given rightfully 4 lakh rupees by the government of India. And the government of India is not, agreeing to pay that. So these type of things are carrying on. But one thing which I have realized, and that is, which I'm sharing with all of you, is that never again in our history do we want to go through such a kind of a situation again. There were no ambulances. There were literally, people were, going from hospital to hospital to find one bed. If they reached the hospital, the ventilators were not there, the oxygenators were not there, the drugs were not there. So I think this has taught us a very nice lesson. And it is written that people who don't, learn lessons from history are then also going to repeat it and not, go further. So we are an intelligent kind of people. You have seen how Indians have done well all over the world, even in India, so well. So I have no hesitation in saying that, yes, we will come over it, provided we are responsible. And this responsibility factor starts from each one of us, and we should be able to carefully jot down our position. As I said, that I am a diagnostician. My job is to, make available all these tests for COVID. And please remember that not only COVID RT-PCR test was there. Now there's a new test known as a rapid antigen test, whose sensitivity has increased, has become much better. So maybe tomorrow, we hope the third wave does not come. But even if it comes, we should be able to get on top of it, quickly test the people, give them quick reports so they are tracked and isolated, treated, and also vaccinated. My last, prayer to all of you would be that please do not think twice about vaccination. Please go and get yourself vaccinated as early as possible. Don't start thinking Covishield lagwani hai, or Covaxin, or Dr. Reddy's, the Russian Sputnik V vaccine, anyone which you can, get on. But please don't be without a vaccine, because this can cause you so much immense harm. Let me give you statistics from England and also from UAE, that 99% of the people who have died in hospitals were not vaccinated. So I'm not saying that after vaccination you cannot get infected. Yes, you can, but you will not die. You may not be put on ventilator. So with these words, I would like to thank you once again. Thank you very much.
Thank you so much, sir, for sharing your valuable comments and advice with us. And I hope it will help the masses once, the paper is out and we, incorporate all the comments that you have made and all the advices that you have given to the people. Now, I would like to introduce our next speaker for the day, Dr. Shiban Ganju. He has dedicated his life to healthcare, and over a distinguished 45 years career, he has contributed at multiple levels as a physician, as the founder of Save a Mother Foundation, focused on developing sustainable healthcare solutions, as a leader and innovator in healthcare firms, and as a participant in advocacy with policymakers. He has also been an advisor to foundations and think tanks of healthcare. Let's hear from Dr. Ganju what we as India can learn from a developed economy like the US.
My name is Shiban Ganju. I've been invited to talk on what India can learn from the developed economies regarding healthcare post-COVID. I will keep my comments brief limited to 10 minutes. I want to dwell on 4 important points that we can learn from the West. Number 1 will be increase spending. Number 2 will be building infrastructure with the healthcare expenditure. Number 3 will be work on the demand side of the healthcare system. And number 4, improve purchasing mechanisms to buy services from the providers. These are the 4 areas where West is far ahead of us, and we have to learn from their experience, which started somewhere in 1883 with Bismarck in Germany. So we have close to 150 years of experience in the world of healthcare and how to organize it. And there's considerable information out there that we can adopt. Now, Indian healthcare expenditure is one of the lowest in the world. According to WHO, we spend 3.54% of GDP. This data is from 2018. This includes both private and public spending. The public spending is close to 1% and rest is the private spending. Now 3.54, even in aggregate, is one of the lowest in the world. The least developed countries on average spend 4.02% of the GDP. Lower middle income countries spend 4.09%. EU, European Union, spends 9.85 on average of GDP, and US spends close to 17%. Our per capita expenditure in India is $73 annually, which and a purchasing power parity is about $275, and the US is $11,000. With this vast gap, it's quite obvious that we cannot provide the world-class advanced healthcare. So the first important thing is we have to increase the investment in healthcare. It has been agreed upon by all the governments that have come in the past 20 years. Everyone in their healthcare manifestos and healthcare plans have promised to increase this expenditure to 2.5%, including the current government, but it's yet to happen. With this increased expenditure, then we'll be able to match some of the standards of other advanced countries. While matching the standards, it's also important to learn from how they have managed to come to the level that they are at now. Along the journey of their expansion of healthcare and modernizing healthcare, a lot of good things have emerged and a lot of mistakes also have been made, inadvertently though, which we can learn from. Since this topic is for post-COVID healthcare transformation, first proper use of this investment would be building infrastructure. Building infrastructure would include hospitals where they're deficient, especially in rural areas and hinterland of India, buying modern equipment for the hospitals, and creating management IT infrastructure, which incidentally is extremely important with this massive investment. Without a backbone IT infrastructure, there could be a lot of wastage of investment. Now we could invoke a public-private model that if the public money were utilized to build the infrastructure, that is building hospitals and buying land, and the private participation could bring in equipment, manpower, management, and operations. The government could lease this building and land to the private partners for extended period of time, let's say 30 to 60 years. In my rough calculations, I've seen that the GST, taxes on the employees' benefits, and equipment and supplies would generate enough tax revenue for the government to retrieve its investment anywhere from 15 to 30 years. So this could be a functional model of investing money. As COVID experience has shown us, we are woefully deficient in infrastructure. Number 3 on my pointed list was improving the demand side of the infrastructure. Demand side means population health. The healthcare structure all over the world is designed to improve the supply side, which goes only to that extent of removing preventable disease. We have to work and invest in demand side of population health to prevent what is preventable. This requires minimal investment. A mere 15 to 20 rupees per capita per year would be sufficient to do social behavior modification and improve some of the social determinants for population health to prevent disease. As we've seen in COVID, the demand side of this equation is as important as the supply side. If people did not aggregate in groups and would not miss using a mask during gatherings, would wash their hands frequently, and generally quarantine themselves to prevent exposure, that will go a long way in as much as vaccination, hospitalizations, and therapies for COVID would do. In fact, the population health measures of demand side are far more important in COVID and many other similar diseases, and it incurs much less cost than the supply side solutions of vaccination, drugs, hospitalizations, ICUs, and ventilators. So we should work on demand side of healthcare with this investment. Now, having said that, with this massive investment, we also have to ensure that the services provided for the population are properly paid for. There is a chance of lot of pilferage and also inefficient, ineffective usage of investment unless we have our act together and how to purchase services from providers. If there's one area where the West is still struggling, it is this. We do not have a perfect purchasing mechanism of services. Just merely throwing money and hoping it'll solve a particular problem of healthcare is not going to happen. And that's why the IT infrastructure is important. In this model of expanding our services to the hinterland, it's important that every penny that is spent wisely. Otherwise, the cost of healthcare goes sky high and nobody can afford it. The providing mechanisms are all detailed in many countries. It can be bundle payment, cash for payment, co-pay, gateway mechanisms, outcome analysis, payment for value, etc., etc. Many mechanisms have been tried, but the key is the healthcare provider has to be part of the risk taking in the financial system. So far, the healthcare providers only take responsibility for the clinical outcomes. A system has to be developed where the healthcare provider also has a stake in the financing of healthcare and takes the financial risk, which at the end of the year can be either a disincentive or incentive, depending on the performance of the healthcare provider. With these 4 caveats that I mentioned, that is increased spending in healthcare, build infrastructure, including IT management services, improve the paying mechanism to providers, and work extensively on the demand side of population healthcare will go a long way in mitigating many more challenges that healthcare system may have post-COVID. Thank you.
Thank you so much, sir, for sharing your experience and expert comments on how a developing nation like ours can improve the healthcare system. Moving ahead, we have Mr. Sachin Gaur as our next speaker. He is a researcher come entrepreneur in the space of mobile and internet solutions. He was in the top 10 innovators in India under India Innovates Growth Program 2013 by FICCI. He is involved in multiple ventures in the domain of digital marketing, mobile solutions, Internet of Things, healthcare, and AI. He is the director of InnovatioCuris and has also contributed chapters in 2 books on topics of innovations and healthcare. Let's hear what Mr. Sachin Gaur has to say about digital health becoming the new normal post-COVID and how it is transforming the Indian healthcare.
Hello everyone, this is Sachin Gaur and I've been asked to talk about the topic where digital health do we see as a new normal post-COVID in India. And definitely all of us who are, in one way or other joining this program today have seen how a pandemic created, an opportunity for digital health to accelerate in India. So let me make 4 points here today and I will elaborate on them one to one. So the first point I want to make is that we are right now in a growth phase in India when it comes to digital health because we have a strong foundation and inspiration. So when I say growth phase, what I really mean is that if we look at all of us during the COVID, we must have ordered a test online or we would have got a report. Some of us would have also even done some teleconsultations or ordered, in general nutritional or, medicines online. So we all have experienced, this online world when it comes to the health sector. Just to give you an example, we saw that before pandemic, there was around 3 million households as an addressable market of online pharma. And today, online pharma, after 1 year or so, has 60 million households as their addressable market. Now, this is a growth of 20 times. But if you zoom out and if you see that where are we in India in general when population is connected to internet? So as per the latest TRI numbers, I think around 800 million people in India are connected to mobile internet. And what do we need to do when we want to use digital health? We need an identity. We need a mobile phone or a smartphone which is connected to internet. And we need an ability to pay. So more or less, this 800 million people that we see in India is what you can say is the addressable market today for the Indian health sector. So when we compare this with the 60 million household or 240 million or 300 million people who are already kind of becoming consumers of buying medicines online or ordering tests online, I think we still have a scope of growing this market 3 to 4 times in years to come. So I think we are going to see a huge growth phase in the next 3 to 5 years, and this market is going to just explode. And I think, as I said, more or less all of us have experienced this personally during the pandemic, but it's becoming what we can say that digital health has arrived. Now, why I say that, let me segue into the second point, which is big health tech players are paying attention. So what has India seen from a financial market perspective? Let's say a company like Max Health has gone for IPO, and we will see more and more healthcare and pharma companies going for IPO in the last 1.5 years or so. But interestingly, we also saw that online startup dealing with medicine bought out a traditional player like ThyroCare. So this means that big players are paying attention. So companies like Apollo, they did a massive amount of teleconsultation during the pandemic, and we see news again and again from publicly listed companies that how they are adopting digital healthcare. So when you look at it from a health management perspective, digital brings a lot of efficiency. It brings efficiency on both sides. It brings efficiency on the hospital side because they can deliver this service independent of time and space. And the same way for the patient, they don't have to travel. So, for example, if you are ordering a test from PathLabs, you don't have to go to their lab. You can get the person come to your home. So the delivery formats, with the intervention of digital, they're becoming more and more efficient, and they're more and more becoming consumer driven. So my claim here is that we will see in time to come that the bigger players, they will make digital as not something that they want to do just to please their board, but something which will start bringing core of their revenues. And I think we will see a lot of new age startups in this domain. And I think India also saw one landmark event in the last few weeks, which is that a traditional software kind of a company like Zomato going for an IPO for an exit. And this will give inspiration to many online insurance companies and other similar companies which we experience online, that they will increasingly go for IPO. And health sector is definitely one such crucial sector in the economy which is on sunrise in every part of the world. And we will see a lot more companies hitting the IPO, and they will definitely bring in big money to solve these problems. Now that we know that, okay, we have a good foundation, the point that I made of 800 million people or so connected, and of course more people will get connected in India because one of the cheapest place in the world when it comes to connectivity. The second point, that there is already a lot of money on the table from the financial market, and people in the board rooms of the companies are paying attention to this topic. Now let's go to the third point, which is about scope for product and service innovation. So traditionally, when we experience services as an Indian consumer, we only saw a small element online of a larger healthcare service provider. For example, a typical hospital will only provide you online booking for appointment. They were not giving teleconsultation before. Or a traditional diagnostic player would provide you reports online, but they were not doing anything else before. So what we will see increasingly is that as Indians, we are spoiled by big tech companies like Google, Amazon, with very superior products in terms of mobile applications that they give us, which are very easy to use, and they want to make us spend a lot of time using their applications, whether it's Facebook, WhatsApp. And we haven't seen those kind of products and services from traditional healthcare players, which means that the healthcare industry has to understand that healthcare is not just about when the person falls sick, which is, let's say, unfortunately in some cases could be once in a year, or people who are lucky, maybe it is probably once in a lifetime. So if we have to extend healthcare, we have to extend our thinking and take it to preventive healthcare. And that's where a lot of this wearable technology that we see, that a individual can buy, and mobile phone is one of them. Can insurance companies, diagnostic players, hospitals, all these people create value for the person and enable something more for them in the experience? So So the take home message here is that the big players in the internet space like Google, Amazon, and other companies have kind of spoiled Indian consumer. And I think in the long run, the players who will win, they will have to deliver more on the preventive side of healthcare than just traditional, curative healthcare. And which also means that we have to have data organized of a citizen or of a patient in a more longitudinal manner and in a broader manner. It cannot happen that if I had experiences 10 experiences in last 10 years, my data of those 10 episodes of health are lying in 10 different entities, and I myself cannot bring my own data to the 11th provider that I want to go. So there is an element of organizing data from a patient's perspective, from an individual's perspective. And if this data mobility happens, and if this data aggregation happens on a longitudinal level, I think we can empower citizens and patients to take care of their health better, and it will also empower the clinician to do a more precise intervention than repeating a lot of tests and those kind of inefficiencies which make healthcare in general expensive. So I think take home message from here is that there will be a huge amount of competition here, and we will see that the innovative players will actually be the winners here. So we are going to see an interesting time here. Now let me make the last point for today. So when we see all of this, that India has a large population, we also have a growing financial market which is funding a lot of innovators here, and then of course the market is ready and to bring innovations, and so is Indian consumer also kind of quite informed and educated. So where where do we see the role of government here? Because many things wouldn't have happened if pandemic was not there, and pandemic has shown the cracks in a big way in the Indian healthcare system, that how uh, unprepared we were. And I think a lot of us had strong expectations from the government, and government tried its best. But I think if government has to take it further from the initiatives that the government has done, from Ayushman Bharat to National Digital Health Mission, and specifically doing the Arogya Setu app, the Cowin app, I think they have also tasted success, that the people of India are going to adopt such interventions. And government can increase the market by providing large scale universal health coverage through Ayushman Bharat. Government can also provide safety and security for people going online in terms of the National Digital Health Mission, because they are numbering and naming all the stakeholders involved in the Indian health sector. So I think government also has to play a big role in enabling this infrastructure, like government has done in case of Aadhaar, and enabled a big fintech revolution in India. Similarly, I hope that NDHM will enable a similar health tech revolution in India. And I think in the end, all of the stakeholders involved here, they need to be considerate of one thing, which is that the data belongs to the patient. And we have seen in the last 1 year or so many incidents where large companies have lost patients' data and they were not held accountable for. So as we go into this digital future, I don't think we can afford to talk about it as a side topic anymore. It's a mainstream topic, but we also need to be making investments to safeguard the privacy and the security of patient data. So these are the 4 points that I would like to make today, and I would definitely be interested in learning about viewpoints from others. Thank you.
Thank you so much, sir, for sharing your opinion and views on transformation of Indian healthcare system via the digital health and innovation. Next, we have Dr. Sanjiv Kumar, our last expert for the day. Dr. Sanjiv Kumar is an AIMS New Delhi alumnus with 41 years of experience in public health across 29 countries. In the past, he was also associated with UNICEF and has worked for 22 years as health specialist in India and as a chief of child survival and development and senior advisor in Iraq, Kenya, Uganda, and Somalia, and also as a regional advisor for 22 countries in Central Asia, Central and Eastern Europe, and Baltic states. He is the former director of IIHMR New Delhi. Let's see what Dr. Sanjiv has to say on the topic.
Thanks for giving me an opportunity to talk about public health aspects of COVID-19 and how the future will look during post-COVID time. COVID-19 is an unprecedented tragedy we have seen in our lifetime. The last we saw such tragedy was 1919, when in India alone, 15 to 20 million people lost their lives. And that time also we saw 3 waves of flu pandemic. Let's now turn to the COVID-19 pandemic. I will essentially talk about 5 things we have to look at in the post-COVID time so that we are prepared better and hopefully we do not see such an emergency. The first one is COVID-19 has increased our concern about home care. Home care is not only required when you have hospitals which are overwhelmed, but also in day-to-day care. Home care has emerged as the main way of treatment, which was used for treating mild cases of COVID. And very effectively through use of technology, we use remote monitoring using oximeter, thermometer, and early detection of other symptoms of severity, which were conveyed to the common man, and it was handled very well. Then the other technology which helped in home care is use of teleconsultation. Teleconsultation went up many-fold. If people use phone or virtual platforms such as Skype to consult their doctor. Another advantage is many of the doctors who were for medical reasons or other reasons were not available in the hospital, were available with their expertise and experience to guide the patients in home care. The other ways which improved home care is availability of diagnostic samples were connected from home, and many equipment which were not available at home, such as oxygen cylinder, were provided. Pharma industry also stepped in with the home delivery of medicines required for treatment of the patient. So many hospitals had a package for home care linked to the hospital care when required. This kind of continuum of care is essential in managing any disease in pandemic or in normal situation. Second aspect which came up during COVID-19 and will continue later is real-time monitoring. Real-time monitoring of supplies such as vaccine were effectively used. Supplies from production till it was administered to the beneficiary was monitored effectively through an application called CoWIN. It was an improvement over the eWIN application, which was used in routine immunization program in India. Similarly, monitoring of availability of resources in hospitals such as beds in ICU or ordinary hospital beds was also very effectively used. And in the COVID application, the beneficiaries also received reminders for their second dose, which when it became due, people could come and get their next dose of vaccine. Third aspect is medical devices. India did not produce personal protective equipment and ventilators in sufficient quantities, and so many other medicines which were required. The surge capacity was used and other industries stepped in to increase production of these medicines and supplies, and which is going to stay with us. For example, personal protective equipment and ventilators. India was importing from outside, and now India has started exporting these devices to the rest of the world. Another step which was taken was active pharmaceutical ingredient, the raw material for the vaccine was imported essentially from China. About 70% of it came from there. India has started more production of local API so that its dependence on other countries comes down. The fourth aspect is in the health system, primary health care, which has not received attention during COVID and is going to receive attention in future. Similarly, private healthcare facilities were not integrated well into public system. They were brought on board later, both for diagnostics and hospital care. In future, they need to be integrated so that they provide more comprehensive care. Within health system, public health experts did not receive due attention in the past. During pandemic, it was realized that they need attention, and this aspect is going to receive more and more attention in post-COVID period. Another aspect which is rarely discussed both in the media and also in technical groups is that the international dimension of communicable diseases needs more attention. For example, in COVID-19, it started in Wuhan province of China. Local travel within China from Wuhan to other parts of China was restricted. It was banned. However, the international flights were not stopped for many weeks after local restrictions were put into place. This resulted in many patients with the disease traveling to other parts of the world. For example, in United States alone, 550,000 people had traveled from Wuhan into United States, resulting in a huge outbreak of the disease for which United States was not prepared. Similar situation was seen in many countries in Western Europe. Vaccine nationalism. Many countries hoarded the vaccine, placed advance order. Even today, many countries have not been able to start vaccination program for COVID because they do not have supplies. COVID diplomacy is another term which came into existence because of COVID-19. Countries preferring some countries or keeping their own drugs and vaccines within the country, restricting export of raw material required for vaccines, etc. So these are the aspects in which we need to increase the accountability of international bodies such as World Health Organization and United Nations, so that countries can be taken to task for not taking action in time or hoarding vaccine and supplies within the country at the cost of providing these supplies to the parts of the world where these are required more, or the countries which cannot afford. So this aspect of equity across the world needs to be given more attention, along with increasing accountability of the countries which do not take action in time, putting the whole world into a dangerous situation. So these are the 5 aspects: home care, real-time monitoring of hospital services and supplies, uh, improvement in local production of medical devices, and strengthening of health system and international accountability will need more attention in future because of COVID-19 pandemic. Thank you.
Thank you so much, sir, for sharing your views on public health issues. With this, we come to an end for the talks from the expert. But now I would request all the experts who are online with us today to switch on their cameras and share their last comments for the day and one key takeaway message. So we will start, we'll have the flow, like we'll have Dr. Amit first, then we will go to Dr. Shiban Ganju, followed by Sachin sir and Dr. Sanjiv thereafter. Over to you, Dr. Amit.
So, yeah, I'm privileged to hear the lovely comments and views from experts. So, thank you. Well, I'm in complete, I agree with all the experts' views where, they've put in, articulated such beautifully on the bullet points of action to be taken. And it's been a learning phase. Few things is digitalization, more penetration into the primary healthcare, and policies of digitalization needs to be immediately taken up. These are the few points which I feel, I mean, this is the need of the hour from my end.
Great. Thank you. I think we can move ahead with Dr. Ganju.
Healthcare expenditure should be classified as investment. Healthcare investment is a GDP driver, it's an employment generator. The biggest employers in the world are healthcare and education. So we should not look at healthcare purely as expenditure, but an investment that gives you returns both in terms of health and improvement in economy. So take-home message from my side is, let's invest more in healthcare. We've been waiting for too long, more than 25 years. Let's follow the manifesto of every political party that has promised us increased investment, increase the public investment to 2.5%, and invite private players to make a PPP model in the hinterland so we can work together to transform the healthcare within the next 5 to 10 years in India. Thank you.
Thank you so much, sir. I think we all agree to that point. Sachin, sir, your comments, please.
Thanks, Parthvee. It's a privilege for me to be in the company of real experts. I'm more like an outsider to healthcare, but I feel it's an appropriate timing, that India is going to grow like huge in the next 10 years. And it reminds me of the book of Gurcharan Das. He wrote a book which is called India Grows by Night. And he highlights, how Gurgaon became so successful because of the private investment. I think this is what is going to happen in the startup space and the healthcare IT space in India in next 10 years. So hopefully every stakeholder, can play the important role, and we just don't get healthcare as a big sector like Dr. Ganju is pointing out, but also more accessible and equitable for all kind of population in India. Thank you. I'm done.
Thank you, sir. I would like to invite Dr. Sanjiv now for his last comments for the day.
Thanks. It's a pleasure to see Shiban Ganju, Dr. Arvind Lal, and others virtually. We haven't seen each other physically for a long time, but this is a good opportunity. And the team at InnovatioCuris, so that's a pleasure. I will emphasize 4 points, starting with international dimension. We have to nip the evil in the bud. That was not done in Wuhan, and the whole world suffered. It is one world. Earlier, it used to take you 1 year to go around the world. Now you can go around the world in 1 day. The possibility of pandemic spreading to other parts is even more, and get countries accountable for not controlling an outbreak. We have not seen any action in that direction. Second, strengthen health system. Investment is one aspect, but if you invest, you need to invest as committed in the policy, 2/3 of investment on primary healthcare. That has not happened in the past. It is not happening today. That needs to be increased. Within health system, we need to revise the health security. The countries which were in the top in the health security assessment before the pandemic were the ones which handled the pandemic worst. United States of America, France, Italy. France health system is #1 in the world. It collapsed completely. Not just India, even the countries which need to have a new definition of health security and how you will look at health system across the world. Third, it is technology which is going to catapult India into providing universal health care. Healthcare is a team effort. We see a lot of effort opening new medical colleges, more doctors, but we never hear about more ANMs and more male workers. Primary healthcare backbone is the grassroots level workers. We need to invest there. Fourth, integrate home care with the institutional care and back. You know, people who go to hospital never stay for the whole life in the hospital, they come home. So it has to be integrated so that you improve overall quality of care, and focus is on quality of life you give to the patient. That can happen only when you improve home care. Thank you so much.
Thank you so much, sir. I mean, that was very well summarized, I think. I will invite Dr. Singh now to make the last comments and conclude for the day today. Thank you.
Thank you, Parthvee, for taking the whole team as required, and everybody who behind the scene who has made it a success for this particular webinar. I had divided this according to hospital services, diagnostic services, the IT services, public health services, and etc. Now, if you really look at it, I will elaborate on. I will not touch upon what has been already spoken, but little bit something on the same line. If you really take the hospital services, which Amit had been talking, we have to have affordable. What is affordable? 100 rupees may be affordable to me. For the street walker, it is not even 1 rupee worth he can spend on the medical side. So it has to be different yardstick below poverty line, etc., but at the optimum cost, which is what is the should be brought. The healthcare delivery system should be at optimum cost, and whatever the minimum baseline cost, individual will bear it, the state will bear it, or so on and so forth. Amit is doing it very wonderful work by providing at the very, very optimum cost. I see in the newspaper, some of the hospitals charge 25 lakh rupees for dengue, 15 lakh rupees for dengue, etc. So we have to have accredited healthcare system. We have 69,000 hospitals, 11,000 plus in the government hospital, and only 350 or 400 hospitals which are accredited, and 38 are the Joint Commission International accredited. That means, what is the balance? Balance are providing what they wish to. There's no accountability. There's no cap what is being produced. Somebody has brought the ventilator from abroad, sold it, and court is asking, is doing a business is a bad thing? What is the cap on this particular ventilator which he was selling it? So we have to really go into detail of this, that hospital cost is optimized and somebody bears this particular cost. We are capable. Management teaches us there's nothing which you cannot provide by management. It is something and there's nothing like ideal. So you can always look for various supply chains, management, services to do so. Diagnostic, Dr. Lal, as very rightly has said, there was only one lab and today there are 1,500 labs. Such a short time we created. Myself and Sachin was asked by some friend of us in the lab, and he says, I can make it, I don't have kits. So we did not have the kits. Now we have the kits available and we could produce it, and the cost has been slashed considerably for these tests. So it means Atmanirbhar or otherwise it is possible. But there was also push by the government that the labs cannot charge what they wish to, and it has to be posted. Dr. Ganju has very nicely elaborated on the cost. Cost is one factor where you would find what should have been the cost of oxygen flying from abroad in the aircraft of Air Force, and also oxygen express of trains, because states were given some funds and they failed to do so. And ultimately they started blaming the center and then they taking the case to the Supreme Court. Is this the medical model we have where polity want to dish out his responsibility to people? Yes, we as a citizen also have certain things to do so. You would also find during, because I have also participated in one of the person who was making the disaster guideline and accreditation guidelines. Accreditation clearly says every hospital must have a disaster plan and should practice twice in a year. Have we done it? We are not even accredited hospital. So this need to be really looked into it, that it can be done. Sachin very nicely spoke, National Digital Health Mission, Ayushman Bharat. I've got 3 points. Very good if you really read that everybody will be registered. I hope we meet the timeline. And secondly, we make people aware. We had a driver of a company, our own Sachin's company, and his wife was having a problem. I said, why did you get it done from Ayushman Bharat? He asked me how to do it. And my whole office is trying to find out how to do it. This is awareness at my level and my office executive level. You can think that how a person can utilize these services. Are they aware of all these things? Very nicely, Dr. Dikshit has brought something that we have to look for quality of life that can be given by public health and that can be given by the primary health care, and hub spoke model can only be done. There are hundreds of best practices in the world and not very costly. We should try to bring those practices. I was heading a delegation, went to Iraq immediately after war when I was in uniform, and I found very wonderful system. The healthcare, primary health center was air conditioned, but the doctors were not willing to stay there in those places. So in the morning, the doctor specialist will go in air conditioned bus organized from the district headquarters, treat the patient and come back in the evening. That means they were assured to be with the family, yet attend all the people at the distance, and assured that these people will move because they are moving in a government transport. So these are the few things which really can handle. We, in our own country, General Khaduri, when he was a chief minister, I had known him from the army days, made a practice, and he told me that people all want to be in Haridwar, Dehradun. I can't provide, they don't want to do so. I have tried something that everybody will get X amount extra, assured government cost house at the government cost where children and family can stay. And he said, now I have reversed it and people are willing to go. So there are practices in own country. Odisha was giving the oxygen to other state. How and why? So that means there were good practices, and they, rather than throwing mud on each other, as a citizen, as a politician, and we should copy these things and make a good model for India in the future. I'll compile all this, circulate it, and then we will circulate and send it to everyone in where, to policymaker, to everyone. Hope something can be done. Everything can be done, but political will and push is required. And I presume that this government is more serious than the earlier government. I have no political affiliation with anyone. Anyway, thank you very much, all participants, all speakers for their good time, and hope we as a good citizen, we do our duty as a citizen and we can take it forward, such good practices. Thank you very much. Thank you.
Thank you so much, sir. Thanks a lot. Thank you all. It was, heartwarming that all of you took time out of your busy schedule and join us today. And just a small good news I would like to share while we were discussing and having this meeting. So India has won its first gold medal in Olympics into the javelin throw by Neeraj Chopra. So have a great, congratulations, I would like to say to India and to everyone, and have a great evening ahead. Thank you. Thank you so much all.
Ladies are all congratulated by Prime Minister. Okay, thank you.